And welcome to another edition of the Voters Diary. My name is Vivian Kai Lokko. Thank you so much for making time to join us. So we still continue the discussions as we're preparing for the elections scheduled to take off in December. Today and for this week, our focus is on health. We're looking at the policies governments, successive governments have implemented or made plans towards implementing and where they've gotten to. Later, we'll look at infrastructure and a lot of things around health. We'll be right back. Don't go away. And welcome back to the Voters Diary. My name is Vivian Kai Lokko. So today I'll be doing today's discussion with two gentlemen. I'll be doing it with Selorm Adonoo. He heads our features and articles decks here at Citi FM and Citi TV. Selorm, welcome.
Thank you, Vivian.
And also I'll be doing it with Kojo Akoto Boateng. He also heads our new media team here at Citi FM and Citi TV. Kojo, welcome.
Thank you, Vivian.
Okay, so today we'll just dive into the manifesto of the two parties. I think we can, if we can do 2016 and 2020. If not, we can just do 2020 because most of the issues raised are quite similar with 2016 and 2020. So I don't know who's going to start first to take us through the structure, what we have, and then we'll go into the details of maybe should we start with the one in opposition or the one in government?
Well,
I think, don't mind?
No, I don't really mind, but
okay.
I think we start with the one in government because they owe us accountability in that sense.
So if we can, let's start with the MPP 2020, I believe that's the document you want to use, their manifesto on health. And first they start with their promises, quite a lot of that, and what they've done so far. And then they go ahead to tell us what they intend to do as we move along. So if we can, I can run through if you're not ready.
The promises, okay, so if you go to page 61 of the NPP manifesto, they have the promises and what they've done so far. So they say that they promise to restore the nurses trainees allowance, and so it's been restored. Facilitate the early placement of trained nurses, public health personnel and teachers denied employment by the NDC. And what we've done so far, all nurses denied engagement by the NDC have been placed. Provide free specialist postgraduate training. Free specialist postgraduate medical training commenced in 2018-2019 academic year. Strengthening the National Ambulance Service. Over 300 ambulances supplied to the National Ambulance Service, one in every constituency under the One Constituency, One Ambulance initiative. And also they've been provided with a state-of-the-art digitized command center to field emergency calls and to dispatch ambulances. Establish centers for cancers and cover the cost under NHIS. And what has been done so far, breast cancer is already covered by the scheme. Herceptin, the expensive cancer drug, has now also been added and is paid for by the NHIS. And point 136, expand and equip medical schools to train more medical doctors. The whole regional hospital has been converted into a teaching hospital. So that's what we are being told has been done so far in that particular regard. Collaborate with private sector to engage, to establish wellness clinics. And they say this is being piloted with GIZ, under which wellness clinics are being set up within the Dodoa, Legon, and Tema hospitals. Okay. Rescue, restructure, and increase budgetary allocation to the National Health Insurance Scheme. And what has been done says that NHIS has undergone restructuring, including digital and mobile membership renewal and real-time data authentication. Members increased from 10.6 million to 12.2 million. And NHIS arrears have been reduced from 12 months to 3 months, making the scheme sustainable. Another point on what was promised, pass legislative instrument for the implementation of the Mental Health Act. And we've been told that Mental Health Legislative Regulations 2019 has been brought into effect. Implement the National Epidemic Response System. And what has been done is electronic system for early detection has been established.
Okay.
There are 3 more to go, so let me just run through them. Upgrade all existing district hospitals where they exist and where they do not exist, establish one. And point 1, Ga East District Hospital has been completed and commissioned, while 10 polyclinics have been completed and commissioned in the central region. Construction of 5 district hospitals in Sola, Tolon, Somanya, Buipe, and Weta, and a polyclinic in Bamboy are ongoing. We have begun the process to construct 101 hospitals with accommodation for doctors and nurses in districts without hospitals across the regions. Remember the districts and the new regions, so that has been captured. And then construction of a district hospital at Obuasi, Enyinem Trauma Hospital, and the rehabilitation of Inyirisi Government Hospital have been completed. And the last 2 points, introduce drones in the distribution of blood and medicines. This point basically talks about the 4 medical drone centers established and operational, Omena, Komampon, Walewale, and Sihiri also. And they say that at the end of June 2020, 79,000 medical products had been delivered to 945 health facilities. And the final one is enhanced treatment of sickle cell disease. In collaboration with Novartis, we are making available a new drug which was previously only available in developed countries to sickle cell patients in Ghana. And this is a game changer in the treatment of sickle cell. So these are the promises the NPP has captured in their manifesto and the delivery so far according to the work they have done.
So let me say that as we go along, we'll be running through these promises to really check if indeed they've been executed. Not today, but during the week we'll be doing that in terms of infrastructure and with cases of policy as well. We'll look at that. So these are the promises. They say these promises they fulfilled. And then they go ahead to now tell us what they want to do moving on. And that's a lot. About 3 pages or so of what they intend to do moving forward. I
can run you through that. So moving forward, the NDC says, the NPP says they will focus on health promotion and prevention as part of primary health care through the National Health Insurance Scheme to achieve universal health coverage. And so under this particular point, there are sub points that I'll skip. I just want to give the main points. So they say they will review and overhaul healthcare financing with the aim of reducing the turnaround time of claims management and ensuring sustainability of the NHIS scheme. Deliver on the largest healthcare infrastructure investment by any government in the last 50 years by undertaking Agenda 111, previously Agenda 88 project, which includes construction of 101 standard 100-bed hospitals, 6 regional hospitals, Ghana Center for Disease Control, and 1 new regional hospital for the Western region, and the rehabilitation of the Ifiam Kwanta Hospital. And also they talk about construction of infectious disease centers for each of the 3 ecological zones, coastal, northern, and middle belt zones. Complete ongoing hospital projects and related infrastructure. Complete the ongoing digitization of medical records. Harmonize the functions of the Health Facilities Regulatory Agency, NHI, Pharmacy Council, health professionals regulatory bodies, and others to ensure licensing, accreditation, and regulation. And expand access to medical schools in Ghana by building additional facilities and augmenting its human resource base. And work with the Ghana Medical and Dental Council to streamline the admission processes for foreign-trained doctors. And also support the development of traditional medicine while supporting the private sector to ramp up production locally. They will eliminate import duty on sanitary pads to improve health outcomes, particularly for girls, and also continue to recruit trained health personnel and distribute them equitably across the country. And the final one is focus on telemedicine to enhance health delivery. So these are the new promises that the NPP is making.
And then beyond that, they look at the COVID-19, the impact, and then the way forward on that. If you look at the NDC's manifesto as well, something similar is in there. Kojo, I don't know whether you want us to run us through their COVID-19.
You want me to go to the NDC's manifestos?
No. If you have the impact of COVID and what they say about that readily available to you, we can run through that. Then when we start doing the comparisons, we'll look at the two, what they're saying. But if you're not ready, we can come to Selorm on the NDC zone, then we start the discussion proper.
Yes, so the NDC manifesto has quite a number of promises it wants to implement in the from 2021 should they win this election. And that particular sector of the economy, health, is captured under what they call the human development section of their manifesto. And the NDC is being actually trying to own the space of health infrastructure, etc. So when you take a critical look at what they are promising, a lot of that is in infrastructure. But it starts really with talking about policy. So it says that it will provide, or it hopes to provide, free primary health care. I think as the days go by, we will delve into what this free primary health care really means. It also wants to encourage preventive care, health promotion, and wellness. And that is a huge aspect of it if you look at it holistically in the health delivery aspect of our system. Reduce maternal mortality by half, that is 50%. Introduce antenatal incentives. Amend the law to provide 4 months maternity leave in addition to existing legal maternity provisions, and then grant 7 days paternity leave. You know, when I heard this, I asked myself, why not 6? You know, because we've always had the discussion that
the women, we want 6, not 4.
So, but as I thought about it, I thought, of course, certainly it's a good thing to have.
At least 6.
And the men have not been left out in this. Men are
and
also
the men 1 month, not 1 week.
No, some 7 days paternity leave. That's not bad. I think as we speak, we're at 0. So if you are getting 7 days, that's fine.
Nice.
Provide free sanitary pads to girls in school. This is I remember in 2007, 2008, there was this discussion. No, I think it was 2000 and, I mean, when NDC was in power, there was a loan agreement which had as part of it an incentive or something to buy sanitary pads for girls. And some MPs were not really happy with it, that as a country we were going for loans to provide our girls with free sanitary pads.
That happened when we were talking about the secondary education improvement project.
Okay, exactly.
And there was a lot of uproar about that particular thing because we were taking a loan to construct new secondary schools and to increase access. And the government also, as part of that, wanted to provide sanitary pads for girls in the private area so that they could go to school. And it became a whole big thing, which had even the World Bank issuing statements to clarify some of the things under that particular project. And so that was Secondary Education Improvement Project, signed under the NDC. Now, when the NPP came into office, they extended the Secondary Education Improvement Project. So they've also taken some money from the World Bank for the Secondary Education Improvement Project to continue so that we can invest in more facilities to increase access to schools.
So that's great. So it was interesting that women in Parliament actually were up in arms against the government of the day because they wanted to take loans to do this. But this somehow has found its way again into the NDC manifesto. I think it's a great thing to do because when you look at the rural areas, for example, a lot of girls don't go to school because they are in that time of the month, and because they don't have the means to take care of themselves properly, they are unable to go to school. So if you are to be missing between 4 and 5 days every month, at home because of this, I don't think it helps so much. I think the NPP has a similar thing, but when you come to the comparison, we look at it. They want to also train personnel in domiciliary and palliative care for the elderly and then the sick, and this is quite an interesting one. Also, to establish special exercise parks and recreational centers for the elderly. I mean, when I saw this, the first question which jumped at me was, where are they going to get the spaces? Because when you look at our urban areas, for example, because there are elderly people in our urban areas, and these elderly people also require to exercise. So if you want to establish recreational centers and special exercise parks, where are you going to get the land? How is it going to work? Is it going to be every community or every district or every region? I think we need some more clarity on this.
But we need the parks back.
We need the parks back. But you see, the interesting thing is a lot of the spaces in our communities have been sold to estate developers. And so we don't really have, when we were young, we used to have places we played football. But now all those places have been sold out to estate developers or to developers. And it will be interesting to know or understand how the NDC hopes to do this. I don't know whether they intend to buy some of the lands from the people or use the instrument of state to compulsorily acquire lands in certain areas. I don't know.
But is it not sad that over the past 3 decades, and I always use 3 decades because I'm a little over 3 decades old, if we're Sutherland Children's Park, Kumasi Children's Park, go to the various children's parks across the country.
I think Tema is quite a well-planned area. There are a few parks.
They had a park, which now is.
But my point is, we've left all the parks the children's parks to disintegrate.
Yeah.
So you go to Ifa Sutherland and it's a ghost park. You go to Kumasi Children's Home and it's a ghost park. You go to Sunya, you go to all the various areas and it's a ghost park. When we are analyzing this, we should also link it to the housing policies of the various parties. Because if you manage housing well and urban spatial planning very well, that's when you can plan for parks, you can plan for roads, you can plan for inclusion of schools, social services, and all those things. And I think that we are seeing this trend also because all the governments have failed in ensuring proper housing delivery in the country. That's why we are seeing the planlessness happening around us, with no planning for parks, with no planning for, and then you see a church next to a school or a residential area. You see you don't see any coordination in planning to deliver the services such that there will be harmony. Residential areas, industrial areas, commercial areas, semi-industrial areas, mixed-use areas. Now, every place is mixed-use, and we don't see. So, all these things, they will be able to achieve them very well if they get a solid housing policy which they can implement.
You see, that's an interesting point. But given how our development trajectory has been, and the fact that governments have a 4-year mandate, it's always going to be difficult to rule out a comprehensive housing project and get that done in 4 years. So again, that brings me to the tight subject of having a national development plan, a long-term plan. So you know that in the next 10 years, we need, let's say, 1 million housing units.
Whoever comes, this
exactly,
is it.
And when you come, maybe there's a quantum you can do, so you go ahead and do. You don't go and start one elsewhere, dissipating taxpayers' money, etc. So, for example, the MPP was doing an affordable housing project. It's not really been concluded. NDC came, they started a different one. We have the Saglemi and a few other places. NPP has come, they are also starting another one. There's a place around Amasaman, they are trying to build some housing units. So they are not properly coordinated. So when things like that happen, you have instances where you have a lot of money locked up in concrete, nothing really happening, and the people supposed to be getting the benefits of same, end up, not benefiting anything. So this is a very important promise. Maybe we need to extend it beyond the NDC and then see what other parties think in terms of this. That is providing the recreational centers and exercise parks. And also, like Kojo mentioned, there are the Kumasi Children's Park you mentioned, the Sutherland Children's Park. I hardly see people there even. I mean, exercising or taking walks, etc. And yes, and a lot of them too are at the city center.
If you want to rent it for events,
then you go and rent it for your wedding, etc.
Not for a park.
But yes, we need to get to a point where we have these parks in the communities. If I live wherever I live, I won't travel all the way to Accra Central to use the children's park. I mean, it's a lot of work, and why would I do that?
But maybe the essence of parks and all that is lost on us.
The issue really is we've not been socialized on the value of parks and recreational centers, partly because the people supposed to lead the socialization are at fault. They know they have not provided those spaces, so there'll be no point in they teaching us or socializing us to value parks and see the importance of same. On the other side, others could say that parks are really meant for exercise, etc. Our system is such that people walk anyway. People like, not that people consciously exercise, but by the nature of the system, you will have to walk, you'll have to run, you'll have to do a few other things. The ordinary man, maybe if you want to talk about middle class or people in the upper class, they have cars, they have to travel. I mean, they have cars to use every time, so they will need those, people will argue. But I think it is important as a community, we have these parks around. When we were young, we played football on parks in the communities. All these parks are no more. So I really hope that should they get the opportunity, this aspect of their promise is implemented and helps the system.
Okay. And what you were taking us through, quite a lot.
Yes,
so you've just done about 8 or so.
Quite a lot.
I don't know whether
establish
you want to...
a Patients Protection Council to fully implement the Patients' Rights Charter. Also reduce the cost of medicines by introducing a policy of framework contracting for pharmaceuticals. Provide free anti-snake serum. I thought it was already free.
Especially...
But what happens is that there are people who get it free from certain sources, they hoard them, and then they release them in bits to people. So once the supply is being it's been controlled or the supply is been impeded that way, now you have to go the extra mile before you get it, so you have to pay. So even though from source it should be free, at the ground level it is not free. That is a sad situation we have there. Yeah. And when you go to the northern part of the country and other rural areas, you see where a lot of
snake bites, and then apparently they are paying for it.
Yes, because we had the Central Medical Stores fire. Yeah. Which depleted our stocks of essential medication. The regional medical stores, if you go to a lot of them, they do not have the right amount of the medication they have to store. You go to the district medical stores, they do not have them. So there are certain things that are supposed to be free, but you have to buy them. And I've had this experience several times.
It's very sad.
You go to the village, I take my mom to the hospital, government hospital, national health insurance, basic medication that sometimes are supposed to be on the health insurance list, not are supposed to be, which you must get for free. There are medical stores, they don't have it. So then you have to go and find a private pharmacy and buy it. So there are certain things which are supposed to be free, but they are not available. So you have to go buy it and pay your own money to get it. So that's how some of those things happen.
Okay.
They also hope to establish a cancer and kidney disease trust fund to support Ghanaians who need assistance for such conditions, and as you may realize, kidney diseases, cancers, and a whole lot of these non-communicable diseases are on the rise. They also want to declare renal or kidney failure, diabetes and hypertension a national health emergency, and provide better access to affordable treatment for persons suffering from these illnesses. They also want to reward healthcare workers who accept postings to rural communities and underserved areas with a 5-year work abroad program. They also want to amend the National Health Insurance Act to provide an exemption to persons aged 65 years and above. What currently pertains is if you are 70 years and above, you are exempted from paying premiums. They are saying when they come, they will amend the law and make it 65 so that many more people can be exempted from paying premiums. They also want to resource the mental health fund, introduce a co-share payment arrangement for the cost of treatment and drugs for all pensioners. If you talk about a co-sharing mechanism, I mean, the provider and the one seeking the care will have to share the cost of treatment. Yeah. So I wonder what they want to do with this, because they hope to strengthen the health insurance scheme. They hope to do many other things. So I'm wondering at what point this co-sharing arrangement will exist and for what ailments. They also hope to ratify the ILO Maternity Protection Convention, strengthen public health education and promotion, promote healthier sexual behaviors, including family planning practices among persons in reproductive age. So now we come to health infrastructure. The first one had to do with policy. Now we come to health infrastructure. They want to progressively transform all regional hospitals into teaching hospitals. Progressively. I think the NDC likes the term progressively. They want to progressively transform all regional hospitals into teaching hospitals. Well, I don't want to be running commentary. So they want to continue and complete health facilities abandoned by the MPP government. Example, the Tepa, Akachi, Kumeu, Abetifi, and Garu hospitals. They also want to construct 2 police hospitals in the middle and northern zones, expand the 37 military hospital, construct CHIPS compounds in electoral areas, and equip them to screen for non-communicable diseases such as hypertension and diabetes. They also want to equip CHIPS compounds with ultrasound scans and train personnel for better antenatal monitoring. The CHIPS compound idea really is, of course, the CHIPS compound is a basic level in our healthcare structure. So what that does is that there's normally a small structure which has 2 bedrooms, I mean two rooms to house 2 community nurses. So they sleep and live there. They have other rooms to take care of the patients, etc. So what happens is they live in the community. That's what they call them, the community health nurses. They live in the community. So in the night, if you have a problem, you run to them. They live in the community. They're able to go around, educate people on healthy living etiquettes or anything at all, immunization, etc. So the essence of that is to catch diseases at their very nascent stages so that they do not, exacerbate or fester to create further problems. And it's been very successful in the areas that been done well. We only hope that the number of CHIPS compounds are increased, and if that is done, a lot of the diseases that get to the district hospital level and the regional hospital level will be reduced, because the diseases will be spotted early and treated before they get to those stages. What that does is it saves the healthcare system, because the system doesn't have to expend a lot of money. Because, for example, if you go to a CHIPS compound with a simple cut to be sutured, what you pay is less than if you take the same cut to Korle Bu Teaching Hospital, for example, because the Korle Bu Teaching Hospital is a tertiary institution, a specialist hospital of a kind, and so it's more expensive to maintain the specialists who work there compared to the community health nurses who work at the CHIPS compound. So it has a lot of advantages. It's a laudable program that was introduced about a decade and a half or 2 decades ago that I think we need to continue. So they want to equip CHIPS compounds with ultrasound scans and train personnel for better. They also want to establish blood banks in all district hospitals and also establish infectious disease units in all district hospitals. They also want to equip all regional hospitals and district referral hospitals with ultramodern equipment such as CT scan, MRI, mammogram, and oxygen plants. They are also hoping to set up a stroke unit with imaging and other necessary facilities in each regional hospital and complete phase 3 of the flagship University of Ghana Medical Center. Also complete phase 2 of the Greater Accra Regional Hospital, also known as the RAGE Hospital, and establish, in cooperation with the private sector, state-of-the-art rehabilitation centers to cater for addiction, emotional trauma, amongst other conditions. They also want to scale up the training of emergency physicians by extending training to Korle Bu, RAGE Hospital, Cape Coast Teaching Hospital, Tamale Teaching Hospital, etc. Now, so we've dealt with the policy aspect, we've dealt with infrastructure. Now we come to capacity building for health. So they are saying that they hope to employ the backlog of qualified health professionals. There's always a backlog. And also support health professionals with insurance to cushion them from unintended consequences of their practice. I mean, the nurses, we were speaking about the nurses strike off before we came on air. And one of the things which a friend of mine was telling me the last time was, when nurses in line of duty get injured or get infected or anything happens in the line of duty, they have to pay the facility they work in to be treated. And I think we need to look at that if we really want to motivate our nurses and healthcare workers to do more. So I think this is what the NDC is proposing here, to support health professionals with insurance to cushion them from unintended consequences of their practice. It is a bit wider than what I said. Support bilateral and other exchange programs for all health personnel to expose them to best practices around the world. Institute a Health Workers Day and establish an award scheme for deserving individual workers and best facilities, including private sector facilities. They also want to ensure safety and protection of healthcare workers and patients, and establish a Professor Jacob Planjuru Endowment Fund for medical and surgical specialist training. Professor Planjuru died in the COVID era, very distinguished professor of medicine, and he was, I think until his death, the director of the College of Physicians and Surgeons, very, very distinguished gentleman we lost sadly. Also, they want to initiate a plan to establish the Ghana College of Nurses and Midwives and to improve the skill mix, numbers, distribution, and provide additional incentive packages. They also want to implement tax waivers in order to assist health workers to acquire means of transport to respond to emergency calls. Establish a housing scheme for health workers and provide residential facilities at all health facilities for health workers. They want to scale up the training of physician assistants and emergency physicians. They want to expand the National Ambulance Training School to produce more paramedical staff, develop a comprehensive public health emergency preparedness policy, and also to establish an oncology center to serve the 5 regions in the Northern Belt. Oncology is a study of cancer, so an oncology center will be a center that deals with cancer mainly. Establish a national imaging reporting center to provide electronic reports for hospitals without radiologists. Also construct regional hospitals in the 6 new regions and the Western region. Provide district hospitals in districts where there are none. Establish 2 national infectious disease centers. So when you put all this together, then you have Agenda 111. Adequately integrate psychiatric care supported with funds in regional hospitals where there is none. And also develop the Pantai Mental Hospital into a first-class mental health facility. Develop strategies to reduce the cost of healthcare by promoting local production of pharmaceuticals, medical devices, and diagnostic test kits. Empower the local pharmaceutical industry to produce more generics to feed the domestic drug market as we began while in office. So it means it began something like that when they were in office. Collaborate with the traditional herbal medicine producers for rapid integration of herbal medicine in Ghana's health system. Establish the Medical Laboratory Science Council. Redeploy the abandoned Onuado medical mobile clinic vans to take healthcare to the undeserved or underserved and hard to reach communities. Build and introduce the Onipa Nua Hospital ship to provide medical services to the inaccessible riverine and fishing communities along the Volta River. Quite a number of promises. So now we come to health financing. So we come to health financing. Then you have a program of action for COVID, and you have supporting how to support frontline workers, etc. Quite a number of things. The NDC is promising
I think we'll leave it
should they come to power.
With the main things, but we'll take a quick break. When we come back, I think based on the two things, Kojo has given us the MPP side, you have given us the NDC. We can now start looking at the issues one by one, and then we can add the financing, and then later on do the COVID both ways. But you can join the conversation. You can send us a message via Facebook or Twitter. Remember to add the hashtag Voters Diary, or you can send us a message via the number on your screen. When we come back, we'll now compare the two promises being made by the two major political parties. Stay with us, we'll be right back.
I'm gonna make most of it. It's a beautiful day, a day to share with you. You make my world go round, It's really got me saying, nice girl.
Bring home happiness.
So welcome back to the Voters Diary. My name is Vivian Kai Lokko. I'm here with Selorm Adonoo as well as Kojo Akoto Boateng. This week we are looking at health. We've started a discussion around the manifestos of the two major political parties, the NDC and the MPP. We've outlined some of the promises they intend to roll out if either wins power. So now we'll look at the issues as raised by the two parties, and I think we can start with policies or infrastructure. Could you're looking at me like you want to say something?
Yeah, before we even enter the issues, the policy and the infrastructure, I'm surprised that the central medical stores got burnt. There was this central medical stores fire. Over 200 million Ghana cedis worth of medication and related items got burnt, and I'm not seeing any straightforward position on that from any of the parties. I feel that the investigations and whatever is being done to deal with that particular issue has dragged. I feel that the policy on restocking the central medical stores or our execution of whatever plan we have, I've not seen any proper intent on that. I'm saying this because both parties are talking about the pharmaceutical sector, right?
Yeah.
And this document I'm holding here is the Ghana Pharmaceutical Sector Development Strategy, November 2018, prepared by the UN, UNIDO, United Nations Industrial Development Organization. You have a central medical stores with items worth 200 million Ghana cedis. It got burnt. We were talking earlier about anti-snake serum, and NDC says, oh, they'll make it free. We talk about malaria medication, we talk about this, we talk about that. We had stocks. It got burnt. And I've not seen anybody mentioning that. And this is key for me because when COVID hit, we realized how feeble our system was, how weak our foundations were. Because for a very long time, we had to wait for China to ship things to us before we could do the basic things we had to do. If it wasn't for the fact that local industry stepped up production of PPE and certain things, would have been in hot waters because the central medical stores were burnt. Our strategic stocks of key medication and medical inputs gone. And I've not heard anything like anything on that. None of the manifestos has anything on the medical stores. And I feel that that's really a letdown, that the parties really have not done justice to that particular topic.
Maybe with the MPP, because the plan is to get it running pretty soon, and the NDC thinking same will be done by the MPP. So it was left out.
Well, the plan is to get it running pretty soon. Good.
I'm just
at this particular point, whether it's going to run or not, something happened which cost the nation $200 million, more than $200 million worth of medical supplies.
I think it's a poor showing on both sides. The NDC was in power when this happened. The MPP is taking over. So between the two of them, I mean, they both failed to, if for nothing at all, bring the people involved in this to book. There was some investigation of a sort, but nobody really knows where that investigation is going. So it is sad. The NDC, the MPP, which inherited power from the NDC, cannot blame the NDC for doing nothing because they have come into office with the full support of the people, and zero has been done on that. The NDC cannot also turn around and say these guys are not doing anything about this because it happened in their time and nothing really was done on this. So what happens is when these two guys, these two parties, in quote, conspire about something, there's nothing else you can do because they are both not interested in seeing this to its logical conclusion. So we can only scream and shout, but once between them they are not interested in finding the perpetrators of that act, we can't go anywhere. In fact, when you look at how that incident occurred, I mean, it will take somebody a hard time to convince me that it was just the accident of fire. I mean, it did not make sense. The timing of it, when the minister was supposed to go there a day or two before, there was a big investigation into certain aspects of that operation, and just when the minister was supposed to have gone there, the fire occurred, and the way it happened, I mean, nobody can convince me that this was just an accident. It certainly had people who deliberately wanted to do something doing this. And it's interesting that since then, many years after, we have not been able to put even a single person before the law courts for prosecution. And
you see, I'm talking about this passionately because sometime in January, we were told of a report on the central medical stores that identified operational lapses. And then the government directed the Minister of Health, the current Minister of Health, with the assistance of experts and consultants to undertake a thorough reorganization and restructuring of the CMS, including its systems, operation and existing checks and balances, if any. Now, if this thing were huge for the various parties, it should feature in a manifesto. And you see, the medical stores is part of the value chain and the supply chain of the health insurance system. And so if we say we are going to deliver universal health care, which is, if you look at the SDG goal 3, which is health and well-being for all, stuff like this should not be left
But should we be surprised at the turn of events, especially because it's taken us so long to find conclusion to this particular matter? Should we be surprised at what we're seeing in terms of the low interest in this matter?
Well,
and then even featuring in
I'm not surprised, but I'm surprised. I'm not surprised that this is happening because there are certain things that sometimes we do not pay attention to enough as a country, or we do not bring to the front burner enough. But I'm surprised because both parties are talking about universal healthcare. Both parties are talking about procuring this, procuring that. For example, the NDC says they are going to get Oniado ship for the riverine areas. NPP says they will do this. This party says they will do that. But you can get all those things. But if your medical supply system is non-existent, that's what happens when sometimes hospitals will be asking us for detergents when there's a cholera outbreak, or people asking hospitals asking people to donate gloves and PPE. So if you are serious about the medical our healthcare system, a core entity is the medical stores, central medical stores in Tema, the regional medical stores in the various regional capitals, the district medical stores, which stock essentials, so that when you need something, you do not have to come all the way to Accra. Or when your uncle in the village needs something, that he will not go to the hospital and the hospital will say, oh, this medication is not available. And sometimes a 5-minute delay in providing the right medication or the right tool can result in death. So I think leaving this out by both parties is something that is disappointing to me. I expected them to think about the medical system, our healthcare system in its totality, and plug all the holes so that we deliver on the SDG Goal 3. And the truth is, we are in 2020. We have 10 years to get to 2030 to attain Goal 3 of the SDG. Will these proposals or manifesto promises and policy suggestions get us there? If they are going to get us there, what structures are we putting in place? Because you are looking at a service for the people, a service the economy can support, and a service that can also help economic development, because a healthy nation is a wealthy nation, right?
Yes.
And we're also looking at health service that will not affect our environment. And then in the end, what structures will you put in place to ensure that this service works? For example, ambulance service. We did one district, one constituency, one ambulance. Administratively, if you look at how the health service administers its work, does it administer its work on a constituency level, or it's national, regional, districts, and then sub-districts? So if you are doing one constituency, one ambulance, how would that be effectively administered? So since we bought the 300 ambulances and the recent road crashes we are reporting, how early do the ambulances get to location to help save people? Because all the road crashes we've reported on, if you look at the reports, some of the people are carried in trucks, pickups, other cars.
Private cars.
We've seen some ambulances going to some of the positions. But you see, investing in these things should help you sit down and optimize the use of these things to help people. It's not just about spending money
to be fair, yesterday, so we are told the ambulance got there within 5 minutes.
That's great. So but I'm just saying that we as Ghanaians must demand of the leaders that saying you do A, B, C, D must come with a plan of optimizing the resource. Because in the end, this is what happens. We'll go and borrow money to come and build Agenda 111. Money to buy A, B, C, D, E, F, G, H. If we don't borrow, donors will give us money to get these things. How do we optimize them so that every Ghanaian gets access to quality healthcare? I think that's the key thing.
Okay.
So I think that the regional, the health minister says that they will build a new central medical stores, and it was, as of 2018, waiting on the health ministry, the finance ministry, to make some funds available for them to build facilities.
Let me just find out. So the medical stores wasn't insured at all?
No, so it wasn't insured. I mean, that's the same situation for a lot of government facilities. If you recall, a few years back, the Commissioner for Insurance, NIC, was trying to push the fact that government facilities should necessarily be insured. You see, it's like the way a lot of people view insurance. Nothing is happening, so nothing will happen. Why do I have to go and pay money for something that wouldn't happen, because for a lot of people, nothing will happen. So Central Medical Stores has been in existence for many years and nothing was happening, you know. So it was just once that there was fire and the whole thing came down. So people have not really gotten to the place where they will want to add insurance to the kinds of things they do. And government facilities are also, you know, at fault when it comes to this. So I think generally what our health system lacks is a certain approach of integrating various facets of the system together. If we don't do that, we realize that we are solving problems in a piecemeal fashion, instead of the various parts coming together to give us one whole health system. We don't have that. We have people dealing with things separately. So somebody says that he will set up, what's the name, a renal and hypertension fund to do what? And then from there, what happens? What happens to our health institutions where dialysis is to take place? I mean, how equipped are our facilities in terms of dealing with renal, kidney, or renal failure and things like that? We just say the things headline, we receive the applauses for them, and then we go to sleep. Because you was talking about building, going for loan and building facilities. We do that, and then we take them as something you've achieved or something you've done. But how the thing really works to bring the results to the people is generally missing. We are just interested in the applause. We are just interested in the infrastructure or the physical edifices, but the soft things that go into it and the soft things they are intended to achieve, usually we don't factor those things in real work. We will say them, but when it comes to really doing the work to ensure that these outcomes are achieved, we don't do that.
Okay, so let's look at the two. The NDC wants to provide free primary health care. The NPP says it intends to focus on health promotion and prevention as part of primary health care through the National Health Insurance Scheme to achieve universal health coverage. Free primary health care.
Yes, so interesting. If you look at the NDC has been quite silent on the National Health Insurance Scheme. I don't really know what they want to do with the health insurance scheme. But the NDC has been playing with the idea of a free primary health care for a long time. And what is primary health care? Primary health care is not the same everywhere. Primary health care really is it's a set of conditions that you consider primary for your situation. So for example, maybe malaria. Of course, malaria should be part of Ghana's primary healthcare package. When you go to a country like maybe the UK or the US or maybe any of the OECD countries, malaria is not an issue there. So it may not necessarily be part of the primary health package. Yeah. So the primary health package is what you deem as primary, basic for your people. So then this is saying that they will introduce a free primary healthcare package. I'm saying NDC has been playing with this idea of primary healthcare, free primary healthcare, because if you recall, sometime in 2015, a review of the National Health Insurance Authority was instituted, and it took them about 1 year to do the review. The conclusions of the review was that let's develop a two-tier health insurance system. So the first tier will be what we call the primary health care, the free primary health care. There were a lot of meetings, a lot of consultations on what should go into the primary health care package. You know, so that was done. Primary health care, which should be free, and then the second tier, that will be the diseases or the conditions that are not primary health care. Okay. There should be an arrangement. So it could be a co-sharing arrangement. So if you present a condition that is not captured under the primary health care, which is not free, between you and the state or between you and the facility or the provider, there should be a way of paying. You know, that hasn't been articulated so much in this, but I'm saying so because I know how that thing came about. So it appears, and that review report is not been touched. It's on the shelf somewhere in the Ministry of Health gathering dust. And it's a pity that 3 or 4 years into this administration's tenure, we've not heard anything about the review of the National Health Insurance. The National Health Insurance Scheme is a very important tool in the sense that it provides a safety net for people who are unable to afford healthcare. Every serious country has a form of social protection for people like that when it comes to health. But in our case, our health insurance scheme has suffered a lot of problems, mainly because of inadequate funding. When the health insurance scheme started effectively in 2005 or so, its sources of funding was great. It was huge, to the extent that there were fewer people on the scheme than the amount of money it had. As the scheme grew, the money they were getting at the end of every period became smaller than the number and became smaller than their needs, their financial needs. So what happened was a health or a funding gap came. So that funding gap meant that, for example, if you had maybe 1,000 cities to take care of the population, maybe by the time you take care of maybe 50% of the people, that money is finished. So between the rest of that people to the end, you need extra money to take care of it. But your money you get from your regular sources will not be enough. So government will have to find money from elsewhere to give you. That was a problem. So the thinking was that once the primary healthcare package was ended, what are the primary healthcare conditions? There are conditions which really are not so expensive to treat. We talked about the CHIPS compounds, the kind of conditions they treat, etc. And when we look at Ghana's disease structure, a lot of the ailments are at that level. So malaria, for example, huge. But how much does it really cost to treat malaria? It doesn't really cost much to treat malaria when it's spotted early, and many, many other diseases. So I think the thinking is that when they are able to rejig the system this way and make primary health care free, that will cut across. As we speak, Ghana is just about 60% or less towards universal health coverage. In fact, only less than about 39% of the population is covered under NHIS, and just about 1% covered under private health insurance. So what happens to the rest of the 60% of people? They are not covered. They have no covering or coverage. So when you talk about universal health coverage, we are a very long way away. In 2016, total membership of the NHIS was around 10.6, 10.7 million. As we speak, it's just around 12 million, which means that in the 3-4 years the MPP has come, we've only added just about 2 million people to it. How long are we going to take to include or add everybody, the 30 million Ghanaians, onto the scheme? It's going to take us forever, you know. So I think the thinking is that this is a quicker vehicle towards the universal health coverage, so that if primary health care is available to everybody across the board, no matter where you are, you just appear and you are taken care of. Everybody would have had, you know, a fair share of his taxes being charged into healthcare, etc. Because as we speak, we say the health insurance scheme takes a premium and etc. But if you look at everything, the premium they take from everybody is less than 5% of its total, you know, funding regime. So just 5%. The rest of the money they get is from taxation. Everybody pays taxes. So why should I be prevented from benefiting from a system that is funded mainly by my taxes? So I think the thinking around this is that let's make primary healthcare free for everybody, so that everybody can enjoy it, so that at the primary healthcare level, we would have achieved universal health coverage, and that would be the quickest way to go. So, Kojo was talking about
realistically, realistically, with all our challenges with operations, funding, and because the NHI, you've spoken about, the NHIS has had huge challenges around the money parts. This free primary health care, which is a great one, can we afford to do it?
That's a good question. I think the conversation about health and health payment for healthcare finance, is a pure financing thing. It's a pure financing thing, and we only get it right when we look at the data. Vivian, Selorm, we've had health insurance for over 10 years, right?
Yeah, from 2000, for the laws passed in 2003,
yes,
took off really around 2005.
Now, between 2006 and 2017, okay, domestic private health expenditure per capita, which means individuals paying for their own health, has the trend for domestic has always been higher than domestic general government expenditure on health per capita. Okay. So I spend more on my health than the government spends on me.
You. Yeah.
Okay, it was only 20.
But is that the norm elsewhere? Or is this out of place?
That's a good question. It was only 2009, 2010, 2011, and 2012 that the government's expenditure on health was more than the private expenditure on health. So you see a trend where, even though we've had NHIA since 2003, and it's supposed to make healthcare accessible and affordable.
Yeah.
Over that period, we are still spending more because the private expenditure per capita keeps going up every year. It's increased from $23 in 2006 to $34 in 2017. In 2013, it was at a high of $47 per capita.
But I need you
So
to check
if you-
this. Not to catch you back quickly. I read somewhere that the cost of health for public care in most cases is higher than that of private.
That I don't know.
So
that
you know,
I don't know.
get what I mean.
We can find the
check
data.
that.
So if you look at this trend of data, even though health insurance is there and it's supposed to make it affordable,
It's really not.
supposed to make
Yeah.
us spend less
Yeah.
on healthcare. We're actually spending more year on year. So the questions that the managers of the sector should ask is, how do we deal with this financing issue? Can the state afford the trajectory we are going on? If we cannot afford, based on private expenditure on health, what system can we put in place? I think this issue of sometimes no premium, one-time premium, this and that, considering the challenges we see the NHI also having with financing, we should really look at it. Because over the years, we see Christian Health Association of Ghana coming out and say, oh, they are shutting down their services because they are not being paid. Then private health practitioners, pharmacy association, even this year, they all threatened at a point not to receive people. So it's a pure finance issue, and we shouldn't be populist about healthcare, because the more populist we are about healthcare, the more we kill people. Because people go to the hospital expecting to get free services based on their national health insurance, because he has insurance. They don't get it. The hospitals do not get the funding to resource themselves appropriately to give us quality healthcare. So you go to some of the hospitals and you're getting substandard healthcare. And this is killing and maiming people.
Okay.
So we should look at the financing thing, ask the difficult questions. We need to deliver healthcare for all by 2030.
Okay.
How do we finance it?
Okay.
How do we balance the equation? If we do not do that, we will still be seeing some of the things we are seeing right now.
Okay, let me take some messages coming. Emmanuel from Asamankese says, both the MPP and NDC are to blame for the challenges in the health sector. I'm of the strong conviction that there should be a national strategic plan for the health sector so that the various governments will stop this piecemeal approach. Babamo from Tamale says, fantastic analysis from the Citi team. I'm glad this election is about records. Emmanuel from Takrady says, good afternoon. Fantastic submission by you all. You see, I personally believe that our leaders know what to do to develop this country, but they will not, because they are heavily benefiting from the system as it is. It is pathetic. Maxwell from Kumasi says, good afternoon, Vivian. MPP by far has done well in the health sector and hope they will deliver on their promise come next year. And then Uncle Tom says, colleagues, now that you are discussing health, I hope you talk on the effect of the drone medical delivery. Okay. Guys, our time is almost up. Tomorrow we'll continue with the other policies. We've just been able to look at the free primary health care and what the MPP is also offering on that side. But tomorrow we'll continue with the other issues to do with policies. And then later we'll move to infrastructure. And then at a point, we'll look at the situation proper on the grounds with regards to infrastructure and all that. And then as we move along, we'll look at matters around the COVID, among others. You can always send us a message when we're on the show. Just add the hashtag Voters Diary if you're not using our WhatsApp line. But thank you so much for joining us. I had Selorm Adonoo. He's the head of features and articles here at Citi FM and Citi TV. Also, I had Kojo Akoto Boateng, head of new media here at Citi FM and Citi TV. Kojo. And then my name is Vivian Kai Lokko. Thank you so much for joining us. The repeat of this show is at 10 p.m. tonight. Goodbye.